We know that many people continue to have questions about the COVID-19 vaccine, and we get it. It's new to everyone. Our vaccine team put together some of our frequently asked questions so that we could try to provide some education and help people make decisions, as well as ease some worry.
All of the COVID-19 vaccines being used have gone through rigorous studies to ensure they are as safe as possible. The Centers for Disease Control has put systems in place to watch for safety issues across the entire country.
Both available COVID-19 vaccines, Moderna and Pfizer, help our bodies develop immunity to the virus that causes COVID-19 without us having to get the illness. Both vaccines require 2 doses, 21 days apart for Pfizer and 28 for Moderna. The first shot starts building protection. A second shot a few weeks later is needed to get the most protection the vaccine has to offer. Both vaccines are very good at preventing COVID-19 infection after 2 doses.
Getting both doses is very important. The first dose is a priming dose, giving you about 50% immunity, while the second dose sets in immunity to about 95%. You will not have sufficient immunity to COVID-19 without both doses.
After getting vaccinated, regardless of receiving Pfizer or Moderna, you may have some side effects which are normal signs that your body is building protection. Some people have little to no symptoms. The most common side effects after getting the vaccines were headache, fatigue, and dizziness, followed by chills and nausea.
Adults of any age with these and other serious medical conditions are at increased risk of severe illness from the virus that causes COVID-19. They can and should get the vaccine as long as they have not had an immediate or severe allergic reaction to a COVID-19 vaccine or any of the ingredients in the vaccination.
Sometimes, after vaccination, the process of building immunity in the body can have symptoms such as fever. These symptoms are normal and are part of the process of the body building immunity. The COVID-19 vaccine does not make you sick with COVID-19.
If you are pregnant, we recommend that you discuss vaccine options with your doctor. Experts believe it is most likely safe to get an mRNA COVID-19 vaccine if you are breastfeeding.
Nicollet County continues to follow the guidelines that are given to us by the Minnesota Department of Health. That means right now we are vaccinating early education through grade 12 school personnel and childcare workers. When we are finished with this group, we will be able to begin vaccinating the 65 and over population. We'll start with independent living facilities and those who have underlying health conditions. We hope to move to this group within the next couple of weeks. We're currently collecting information via a survey at this time so that we are able to connect with people who are 65 and older to offer vaccine clinics as soon as possible.
Nicollet County Public Health will continue to widely share our progress in vaccine administration so that people know when it'll be their turn. We have been providing updates via social media, press releases, city utility bills, city hot sheets, and a variety of other distribution lists. Our current wait list is for those who are 65 years and older. You can get on that wait list by completing our survey available on our Nicollet County website or by calling 507-934-8559 to speak with one of our administrative support team members.
Each of our clinics look a little bit different, depending on who we are serving. We continue to modify clinics based on our experiences and the feedback we receive. Clinics are held either at the Nicollet County Health and Human Services or the St. Peter Community Center. In general, people are given appointment times and should arrive as close to that time as possible. We use either lanes or pods to get people vaccinated and then ask them to wait 15 minutes so they can be observed for any possible adverse reactions. We have done a drive-through clinic to provide flexibility for those who might have mobility concerns, and will continue to brainstorm these types of options as the scope of our clinics grows.
Currently, we are using the information provided to us from the schools as well as our survey to let you know when you are eligible to receive the vaccine. Once you are eligible, if you have provided us with an email address, we will send a registration link directly to that email, letting you know you can now sign up for the vaccine clinic. If you do not have an email address, please ask a family member or a friend to help assist you in registering you for the vaccine clinic. If that is not an option for you, we are more than happy to give you a call and register you over the phone. One thing to remember when registering for your first dose is to make sure you are able to attend the second dose vaccination clinic. The second dose vaccination clinic will either be 28 days after your first dose if you are receiving the Moderna vaccine and 21 days after your first dose if you are receiving the Pfizer vaccine. Rescheduling these appointments can be difficult due to the allocations provided to us for those clinics, and we cannot guarantee if you cannot make that scheduled appointment for the second dose when we would be able to get you in for a second dose vaccine. Also, please do not share the registration link with anyone else. Those do come directly from us, and any unauthorized appointments on our schedule will have to be canceled at that time. We are more than happy to answer any other questions that you may have, and more than likely, I will be the one that talks to you if you have any scheduling questions. Bye.